A trip to the dentist. It's a routine that every child should be familiar with. Yet a recent study shows that nearly 1/4 of the nation's children have not had any dental care in at least 1 year. In fact, according to the former Surgeon General, oral hygiene is the #1 unmet healthcare need for children in the U.S. today, with tooth decay leading as the single most chronic childhood disease. Directly connected to one's overall well-being, poor oral hygiene can cause serious health problems as well as social issues.
Well, what we found is that because dental disease is twice as prevalent among kids that are on Medicaid as it is among the general population, we're seeing a lot of other problems as well related to diet, poor diet, namely obesity. And obesity, of course, leads to things like diabetes. And so there are many other health problems aside from just broken down teeth that are associated with poor oral health. And because this population is in the greatest need, we're filling a niche in terms of trying to provide care, find a dental home for these patients.
Particularly vulnerable are children living under the nation's poverty level. The Center for Disease Control found that these children are less than half as likely to have visited a dentist in the last year, with members of racial and ethnic minority groups experiencing a disproportionate level of oral health problems.
The demographics show that in economically disadvantaged areas, dental care is just not as accessible, and one of the problems is that fewer than 50% of private dentists in many of these areas are willing to provide dental services for Medicaid or S-CHIP eligible children. And in fact, only 1 in 5 Medicaid eligible children are receiving dental care on an annual basis.
Healthcare experts agree that the single most effective solution to the nation's dental care problem is prevention. A crucial key to long-term oral and overall health, preventative and routine care helps to create healthy habits that can last a lifetime.
The AAPD, or the American Academy of Pediatric Dentistry, recommends that children visit their dentist by the age of 1 or their first tooth. This gives us the opportunity to discuss prevention with the parent, discuss anticipatory guidance, meaning we let the parents know what is expected to happen next in development. We can talk with them of the importance of brushing and when to brush and how to brush, making sure that they understand each step that their child's going to have next, and then that can be our avenue to prevent decay. So the children that we see early, we really have an even better opportunity that child can be cavity-free their whole life.
Reaching the underprivileged demographic with this crucial message presents a challenge of its own. Kool Smiles is an organization that was created to do just that. Founded in 2002, Kool Smiles is a network of local dentists dedicated to providing oral health to underserved communities. The organization has expanded to 15 states and has served thousands of patients, many of whom had never visited a dentist.
We go into communities where there haven't been dental homes established for children and for families. When we look to put a practice in to a community or to a location, we are specifically looking for areas that are underserved. It's natural when you go into the areas where there's underserved patients, where kids haven't had the opportunity for routine dental care, that you're going to find significant oral disease. We find that when we open our offices. We'll go into an area, we'll locate an area, we'll partner with a community and try to become the dental home for that community. As we see patients for the first time, the effects of dental cavities is phenomenal.
Organizations like these play important roles not only in underprivileged children's lives, but the entire communities in which they live. By working with local schools, daycare centers, doctors, and social service agencies, more and more needy children are gaining access to the dental care they so desperately need.
Kool Smiles is an important part of the community because we want to participate, we want to help provide access to care by letting people know where they can get care, whether it's Kool Smiles or some other source. We want to make sure that they're getting both medical and dental care. We participate in health fairs, we try to do free screenings, and we also participate in things like the Give Kids a Smile program.
Well, Kool Smiles was able to help me as a parent to be accommodating. It was very difficult for 3 children to find a dentist office that could see us all, and even the same day that was even more of a challenge. And so now when I need to make a dentist appointment, I'm able to call and usually schedule us all the same day, so I'm not running all over town just to get dental care for myself and for my children.
At Kool Smiles, providing access to quality dental care is just as important as providing an enjoyable experience for both child and parent. Every step of the Kool Smiles process has been designed to deliver fun and caring service as well as convenience, comfort, and peace of mind for parents, all led by a team of dedicated dental professionals.
Well, now all the children are happy to go to the dentist. They enjoy it because Kool Smiles offer things like a play area and things for them to do. They look forward to coming to the dentist, so I no longer get the battle of you have to now go to the dentist. So it's made our dental experience a lot easier and enjoyable as a family.
By making it their mission to expand access to high-quality dental care for the nation's underserved communities, Kool Smiles is helping give every child a reason to smile. To find a Kool Smiles office near you, call 866-GET-KOOL or visit KoolSmilesPC.com.